MND, which stands for Motor Neurone Disease, is also called ALS. It's a neurodegenerative disease that affects the motor system and progressively makes you unable to move your muscles. 1 in 300 people will get MND in their lifetime, and the average age of diagnosis is between 50 and 60 years old, but you can be as young as 25. Tony, my dad, was diagnosed in 2015 with motor neurone disease. He passed away after 3 years in 2017. My dad was the biggest personality in the room. He loved telling stories and loved being the centre of attention. As I've come to find out, a personality similar to my dad's was Alexandra's dad, Guy Gibson. He passed away only 18 months after his diagnosis with MND.
My life just completely changed, like straight away, because I knew what it was.
Some people with motor neurone disease can live up to 20 years, but this is an extremely rare cases. Doctors still have no understanding of how this might be. Stephen Hawking lived with motor neurone disease for 55 years. Colin De'Ath was told 40 years ago he had motor neurone disease and had 2 years left to live.
I was diagnosed, well, it started, in fact, I was finding difficulty using my left hand. It started to get very weak. And it came to a head one day when I was holding a glass full of beer, and for whatever reason it just suddenly slipped to the floor. But one day the physio walked out of the room for whatever reason, and like you often do, you have a look at your notes. And so I went across the desk, looked at them, saw this name, Motor Neurone Disease, on it. Thought that was strange. It didn't say anything. On the way home, I called into my local library, and there learnt what it was and the type of disease and what it did.
It's going to usually be tripping up, something to do with the arms, so dropping, well, not dropping things, but sort of weak grip is probably a better term, or slurring of the speech.
The first thing that we noticed a change was my dad's voice. He would slur his words often, and he also had trouble drinking and eating. At first, we thought it might be an issue with his asthma or his respiratory system, but all the tests that went through the doctors and neurologists came back clear. A lot of people that didn't know him thought he was drunk, and that was the reasoning for his slurred words, which really affected him mentally, especially as he had never drank alcohol.
Gradually, the motor nerves continue to die within that person's body to a point where they might not be able to walk, they might not be able to use their hands, they might not be able to swallow, breathing's a problem. So the whole of the body is affected, the movement sensors.
He got diagnosed, he had the symptoms in one hand, and he quickly deteriorated. We booked a holiday to go to Cyprus about 3 weeks after he got diagnosed. And by the end of that holiday, so that would have been about 5 weeks after diagnosis, he wasn't able to walk anymore. By the time we got back from our holiday in Cyprus, he wasn't able to use his other hand. So it went from then him using his hands to me using his hands for him. And that was really the change then, because we had to get outside help 4 times a day. I
was in for about 4 days doing tests, and they decided, yes, I had got motor neurone. And they made the announcement. They said, you've probably got 2 or 3 years to live if you're lucky, go home, enjoy your family, go on holiday, make the most of it, because that's what the diagnosis is. I ran a small family business at the time. I had to close that. They decided to close that down, so that went and had to make people redundant, which was very sad because people have been with me for a long time. And also I had 3 children. When you're told that, especially at the time, I remember the children, especially the baby, you suddenly realise this little baby, 2 months old, is never going to know me. I'd just be a photograph in an album somewhere. So, and that made me sort of more determined, I think, at the time, to to try and sort of, something had to be done.
It looks like motor neurone disease is rare when actually it isn't really. But because of that, it means that a lot of general practitioners don't get exposed very much to motor neurone disease. So the average GP will see one person with motor neurone disease in their lifetime. So it's not a lot of experience to gain, and it means that they'll often miss the signs as a result.
People have to have got to a certain stage before they see a neurologist. It has to be very clear there's something seriously wrong. And then, so people will interpret that as a delay. I'm not sure that is exactly what it is. It's the nature of the disease that it progresses gradually, and it will only get recognised as a serious problem when it's got to a certain stage.
I remember the first neurologist appointment that I was allowed to go to. My dad let me go. I was like, notebook at the ready, all these questions.
So we help them adjust psychologically. We give them information that helps them understand what the future holds. Then we see people regularly, every 3 months typically.
It's very important for us to engage with patients. We're doing this for our patients. We want people to understand what we're doing, but more importantly, we want people to benefit from what we're doing.
I think the problem is that for the person diagnosed with ALS tomorrow, it's very difficult to imagine that we're going to be able to cure them in their lifetime, especially if they're in that, 50% of people who have 2 to 3 years left to go. And so we concentrate very much on looking after them so that they have the best quality of life with the time they have.
When I first became involved, there were 18 neuroconsultants in Oxfordshire. Each of those people, if those doctors, if they saw a person living with motor neurone disease, some of them said, there's nothing we can do, there's no cure, there's no treatment, go away and live your life.
That was it, sort of thing, just go home and enjoy yourself. It made me quite angry because I thought, well, there must be something we can do. And it was that got me involved. And I thought, well, we can't just go through life like this. We've got to do something, not for myself only, but for other people in the future. So that's how I was sort of diagnosed in the first place.
Now, with the care centre, people come to Oxford. There are 3 consultants. The care is planned. We have clinics, we have routines, we have monitoring ways to monitoring people. We're looking at respiratory function and nutrition, and we know what to do and when. So it's so much more organised, and hopefully the person is cared for better.
But the amount of times I've had to put my neck out on the line and really kind of shout at people to get what we needed. And that wasn't nice. Like, I was grieving for my dad, even though he was literally right in front of me. And yet I'm the one who has to be on the phone begging someone to give us a breathing machine, begging someone to increase the morphine, begging someone to even tell me what morphine properly is. I didn't, my dad saying, please, can you get more morphine? Well, Dad, I don't actually understand I know it's a drug, but I don't know what it is. People would turn up to my house at 10 o'clock at night for the 10 o'clock shift, 10 p.m. shift, which was working with Dad 10 till 7, when everyone else is asleep. They would turn up for the first shift and say, I'm here for Guy. What has he got? So they didn't even know that he had MND. They didn't know if, they didn't know. They really didn't know that he could have been 88 and just elderly, or he could have been the age he was, 65, and currently living with a terminal illness where he couldn't move his arms or his legs. And I was then administering higher doses of drugs that I didn't really know, well, is this enough to stop him from breathing? Because I was really conscious of the fact that I didn't want to be the reason why, or I didn't want to be the person that put that last drug in that then stopped his heart. And I remember all of this going in my head and thinking, but he's asking for more. He's clearly in pain. Do I give him more? I shouldn't have had to do that. Like, that shouldn't have been me. And even now I think, why has no one stopped that from happening? Also, my dad was a really amazing, kind human, and yet he turned into, for a couple of months, a really horrible person. Very aggressive, very angry. Obviously, because he had MND, so we all understood that, but it didn't help.
People with ALS don't feel ill. So they're watching their body fail, and that's happening very quickly for half of our patients. And that is one of the most difficult conditions I know of in the whole of medicine, really. And they're doing it usually with full awareness.
And we had no idea why this would happen to him, considering he was generally a really healthy person. Because he did play football and he did go to the gym often. Then we did look more into it, and then the media started blowing up into proportions. A lot of news articles, and at the time, a few sports stars started getting diagnosed with motor neurone disease as well. And the media is the media at the end of the day. And they started saying, oh, if you're a football player, if you have repetitive head hits, you're more at risk of having dementia, you're more at risk of having motor neurone disease. And he used his hands a lot. He was a hairdresser. So when his hands started acting up, it was something, maybe we thought, maybe because he was repetitive strain on his hands, repetitive strain on his head. You're playing football, but you played football once a week, every Thursday, with his friends, five-a-side in a gym. It wasn't anything extensive. He was nowhere near professional. It was for fun.
There's a lot of discussion and a lot of thought that people with motor neurone disease are invariably fitter. They're not necessarily, we have very few people who are obese or the kind of sluggish kind of people. They very much have had a kind of a very active and sporty background. And so we do have a lot of people who cycle, who play rugby, who play cricket. They don't necessarily know the links completely yet, but it just happens that there are, yeah.
I always had love for football, like most boys these days, girls as well now, of course, a lot more. Quite right too. So I played in a position which we used to call centre half. It's all back four now, but of course that brought on, you had to do a lot of ball coming over, and there was a lot of heading involved, and clashes of head, because you both go up. You're in the centre of the pitch and people are trying to put it into the goal mouth. You had to try and get ahead of your opponent. So there were a few head clashes and things. They're saying now, of course, that this is a possibility. It may develop into something else, into dementia. Has there any connection with it?
So we know that repeated head injuries will predispose somebody to a form of Parkinson's. That's what Muhammad Ali had, for example, from boxing. And we also know there's quite a lot of evidence that repeated head injury will predispose somebody to a dementing illness as they get older. So we know that, and there is a condition called CTE, chronic traumatic encephalopathy, in which there are brain changes that can predispose to these symptoms of poor memory or difficulty moving. There's less evidence that repeated head trauma will predispose you to motor neurone disease.
So does that mean that doing lots of exercise or being thin gives you motor neurone disease? Well, it's absolutely not as simple as that.
With things like exercise, we get a much more confused picture because we don't record that typically over someone's lifetime. We have to go to the patient with ALS and say, tell me how much exercise you did when you were younger.
The other explanation is that it's not causative, meaning that perhaps fit people have a genetic profile, which means as they get older, they're less likely to tolerate aging changes in the nervous system. So this has by no means been decided. This is still controversial.
If you're someone facing ALS and you've been told that you've got a very shortened life, your perspective might often be, look, I'd just rather try anything you can find rather than not try anything. Now, the problem we've run into is that there are a huge number of things you can try. And the biggest problem, if I had to say what the single biggest problem is, that there's no way of telling if it's working. In cancer, it's really easy most of the time because we can measure the tumor size or we can measure the blood count. But in ALS, we can measure how weak someone is and ask them how much help they need with things. But until recently, we didn't have anything we could measure in a blood test or a scan. And that's been a really, really difficult thing to do. It's amazing to think a condition like ALS could be so devastating for someone, and yet we can't measure something.
At the moment, there is only one drug that is available, that is licensed for people with motor neuron disease, and that's called Riluzole. And we've had that for about 20 years. And that's shown, in some cases, to increase a person's life for 10%, so possibly 3 months, possibly, but that's unsure. But that is the only drug at the moment. And, there are lots of possibilities and possible research projects trying other drugs, but that does need a lot of money.
Since my dad's diagnosis with MND, I've been following loads of news articles about it. I stumbled across a news article that supposedly said there was a cure. I tried to contact the scientists behind this, and they have alerted me that unfortunately this was not quite the case, and they have not yet found the cure.
In Australia, there was a drug called copper ATSM. That is an example of scientists using the word breakthrough when they shouldn't. I mean, this is the problem. So, if there was a drug that was making a big impact, then I would say so. I mean, I think what's happened there is that scientists have shown some promising findings in the laboratory. When these drugs then are taken into human clinical trial, up to now, they have always been rather disappointing. If you keep telling your patients that you're making a breakthrough, then they might eventually, or rather soon, wonder how that breakthrough is going to help them. And we have a big responsibility to help people to understand the limitations of science, not to give them false hope, to explain to them why this is a difficult problem that we're trying very hard to solve.
The community, the research community, the patient community, the charities, we all work together as a group. So we're very collaborative. We work very closely with the charities, we work very closely with patients as well.
And I remember in my early 20s feeling a load of anxiety about the fact that, well, if he's got it, why wouldn't I get it? Loads of people I talk to online do have this anxiety, and it's been actually to the point where a lot of them are on prescription drugs because of it, because they cannot get over any twitch in their body. When I first started Voice for MND, it was really about people more like me, people who had been affected because they'd been a family member or they'd been a carer. But then all of a sudden these people kept coming forward and they were, I'm living with MND, and it became something totally new, not just how has it affected you as a daughter or a brother or a mom or a wife or a husband, but it's affecting you as you.
Well, that was following that when I was quite sort of angry at the time, as I was saying, and something had to be done. And by luck, there was a article in the London Evening Standard. A gentleman had written into the letters column just 7 lines to say that he had been diagnosed 3 years previously, had found no information or anything to help him, and he put the note in, if anybody else is interested in London, please contact this number, which I did, of course. And they had a meeting in West London at this gentleman's house, and there were about 25 of us in the room, and it was from that the association, they were the seeds of the association in 78. And we have people like Dodie Weir, the rugby player, and many other sportsmen have been. There's another one recently, Rob Burrows, a chap, and they've managed to raise millions through various sort of getting well organised and using the people and getting people to send money in and support. And they do people running marathons. I ran in one a couple of years ago on our 40th anniversary in London. It was through the streets of London.
If I can get support from someone like Rachel, someone like from the Oxford University, then it just means that we're going to have a better chance of getting the right accreditation. I've got to have the correct support to be able to make it work. But on a small scale, my aim is to, once COVID is, towards the end of this year, hopefully, when you can freely go into places, I'm going to start offering volunteer support and training support in the local care companies that I know of. and they all are accessed through Mighton Hospice, and basically just do a session per week where it's a choice. So if the carer doesn't want to come, they're not going to get paid to attend. But some people want to learn more. And if you are a carer through choice, as in this is your vocation of job, then I don't see why you wouldn't want to come and have an hour or two where you can learn how better to impact someone's life positively.
With this, sharing stories, information, and raising awareness is really important. This helps fund research and raise money towards a cure.
It is a disease which probably may be slightly closer to seriously good treatments compared to other diseases like it. So now is a good time for resources to be given to motor neurone disease, because we have a serious chance of making an impact in the disease. And I think the science has advanced to the point where, with extra resources at this moment in time, we could do a lot.
I can't tell someone when the cure's coming. I can only say that we'd never have predicted some of the tools we have now. People are talking about editing the people's genetics, the so-called genetic engineering we used to talk about in the 80s, as a sort of science fiction concept.
It's very important to raise awareness because it's a devastating diagnosis. We have to have a treatment for it. It's one of the most feared diagnoses, not just among doctors and medical professionals, but also among patients. Lots of people are terrified to receive the diagnosis. It's very important that there's research to find a cure. And the only way you get funds for research is if people are aware of it, and then you can get the funds because people know this is something that needs to be treated. So it's very important to raise awareness for that reason. It's also very important to raise awareness because if you're somebody who's got a condition and you say, well, I've got this, that's why I'm walking like this, that's why I sound like this, and someone hasn't heard of it, that's actually just another thing you've got to deal with. It's another problem. Third reason to raise awareness is just so that we reduce the diagnostic delay. At the moment, it takes about a year between first symptoms and being seen by a specialist. And that's a long time. We know that's true worldwide, actually. It's very difficult to find a country where it's shorter or longer than that. But on average, it takes about a year to be diagnosed.
2014, the ALS Ice Bucket Challenge gained massive popularity in the US and then traveled worldwide. And we donated money to the cause. And we done the Ice Bucket Challenge on his birthday. So the way the ALS Ice Bucket Challenge really took off, and the way people donated so many millions of pounds.
I do wonder, when will people know what it is without having to... We all know what cancer is. We all know what something like heart disease is. When will we know what the letters MND mean?
I think for a long time, and I didn't really realise, but I think there's something about people living with MND, the complexities of their day-to-day learning and looking after and understanding families and everybody around them. I've always found that incredibly interesting and challenging. Hey, I thought you're not thinking about your dad, and he was quite extraordinary.
Thank you.
But I won't forget him because we went to the same school. So we
Really?
We had lots of because we shared lots of the same. I think he was a bit older than me, but we had a lot of the same teachers, art teachers and things like that. So we used to talk a lot. Yeah.
Oh wow, I didn't know that. I definitely tell my mum something about that. She probably did know. So
no, she knew.
She probably told me, but I went over my head.
We chat a lot because
Oh wow.
His fancy cars and things, and his art and drawing.
Yeah, he did paint a lot.
Yeah, so you do get to know people very well.
The aim of the procedure at Warwick Hospital was to take my brain out, but they couldn't find one.